Guys, so welcome back to my channel. I kind of wanted to preface before I start showing you guys this video. Basically, the video is my labor and delivery story, and keep in mind this was filmed 1 month after I had Sophia, and so it's a very raw and unedited version of what happened, and so I think it's important to share because it's a good not a good, but it's a warning to others that to always trust your gut. And at the end of the day, I should have done that, and I think that would have saved a lot of what happened. But besides the point, it's done and done. It's a done deal. We're a lot better. It's 2 years now, and we're doing good. But I do want to let you guys know that this video is graphic in a sense. I do explain a little bit of how, like, I knew it was infected and stuff. So if just keep that in mind, and I'm really sharing this because I truly believe that it's helpful and it's beneficial to some. So I really thank you guys, and I hope you guys enjoy it. And I'll be posting soon again, hopefully. Bye! Hi you guys, welcome back to my channel. It's me. Long time no see. It's been a minute since I posted a video, but today I wanted to talk to you guys about something that I don't think anyone knows, but I recently had a baby about a month ago, and I wanted to record my labor and delivery story because, boy, let me tell you. So today it's going to be a little bit of a long video, but I'm going to explain what happened in my labor and delivery, and let me say it was pretty traumatic, but let's get started and just ignore this whole, I'm doing the best I can. So this all started June 2nd. I was 38 weeks and 2 days, and I kind of a backstory, like when I was going to my ultrasounds, my doctor had mentioned that my baby girl was big, and we always had the concern of, like, is she getting too big for me to deliver, but that was never addressed. So June 2nd, I went to my OB office for a regular, like, weekly visit, and they took my blood pressure, and it was a little high, so my doctor sent me to OB triage, and the way she kind of said it was kind of like, I want you to go get tested because, we don't have the proper things here to test you. So then, but she told me that she's like, but pack your bags just in case. So for me, that was like, oh, it's going down. So that same day, June 2nd, we, so at my OB appointment, I had an ultrasound, and the lady said that the baby was weighing about 7 pounds 14 ounces. So then I get to the hospital, and of course they start doing blood work, and at this point it had been like 5 p.m. when I got the blood work, and then by 7:30 they came back. The nurses came, and they're like, yeah, your doctor wants us to induce you, like, you're gonna stay, you're not leaving. So then at that point we're like, oh damn, it's happening. So then around like Tuesday at 8 p.m. they put like a pill in my cervix to soften it, and then I had that pill. I probably stayed there, so I would say from 8 to like midnight, and then they checked my cervix, and it wasn't, I believe by midnight it was a 2. I was then at 2. So then at that point they I can't remember that they gave me Pitocin, if I'm not mistaken. They gave me Pitocin, and then they also put a balloon up my cervix as well to try to speed up the process and open it a little more. And so then that probably was from like midnight till like 5, and by I think it was like 5 in the morning, is when I asked for the epidural. At that point, I only had been, I think she said 5 centimeters dilated, so I still had a while. And then, so from 5 in the morning, you know, I just kept dilating more and more and more. And then it got to be like, I want to say 12:30, and it was time to start pushing. I was already 10 centimeters dilated, and it was go time. So I do remember that I didn't start, like, because you know how they do the practice pushes? I didn't start pushing, like, actually till 1. And then, I pushed and pushed. I pushed for 2 hours. And this baby was not coming out. It was horrible. So then I was pushing for 2 hours, and then at that point, my doctor kind of was like, you know, you're not making any progress, like, you've been pushing for 2 hours. And I remember telling my husband, like, before the 2-hour mark, I was like, I literally cannot do this, like, you know, like, so they always say, like, oh, you can't do it, but I was like, I told him, like, I literally cannot do this. And so as soon as I said that, I feel bad, but I vomited all over him and all on the side of the bed. And at that point, it was just kind of like, you know, you have to do something. And so, and also, I had anemia in my pregnancy, which I didn't know that I had until the very last, very part of my pregnancy. And so then, at this point, I already had been bleeding a lot. And my doctor didn't know why I was bleeding so much. So she said, like, she kind of recommended that we have a C-section at this point, which I didn't want, but I also, at the very beginning, even before I gave birth, you know, I talked to my doctor about it, and I asked her, like, is that a possibility? Because I knew this baby was going to be big. Like, I just knew it. So then it was like 2 p.m. and we made the choice to get a C-section. And the whole reason why my doctor said the baby wasn't coming out was because she was too big for my pelvis, and the baby's head was obviously, it was starting to become like a cone. And then that her and I were obviously in a lot of stress because we had been pushing, or I had been pushing for 2 hours, and she was trying to come and she couldn't come. So then I ended up having a C-section, which it was scary, but we had the C-section, and then she was born at 4:31 p.m. and she was a big old baby. She was 8 pounds 5 ounces, and she lengthwise she was 20.5. So she was a big baby. And so then that, you know, that kind of happened. We were in the hospital for 4 days because we got discharged Friday. And then this is where it gets crazy. It gets a little complicated. So we got discharged Friday. Actually, let me give you guys a date. So we got discharged. So I had her the 3rd, Wednesday, the 3rd, and then we got discharged on the 5th, so June 5th. And then, so then we got home June 5th, and you know, we didn't do anything crazy. We didn't do nothing. So then on the 6th, we went to like a little gathering, like a little family gathering. And then that night, I had like the worst pain, like what I thought was the worst pain. Was the worst pain, but I had like horrible pain in my incision where I got the C-section. And I didn't think anything of it. I just thought, oh, maybe, you know, it's just because, you know, I just had my surgery. But the weird thing is that when I was in the hospital, I wasn't in that much pain. Granted, I was on medication. I was on medication, but I still didn't feel like that. And I was on the same medication they gave me at the hospital. So I was like, this pain is very weird. Like, it was totally different. And again, I brushed it off thinking, oh, it's nothing. And then, so then that same day, I started noticing that my incision had like, it was like this is gonna be a little gross, and I'm so sorry, but it had like pus coming out of it, like around it. And again, me not thinking anything of it, I was like, oh, okay. But then it, in the back of my head, it was kind of like, that's not normal. So then that happened. I mean, so Saturday I had the pain, and then Sunday I was totally fine. I was still in pain, but it wasn't anything crazy. And then Monday comes by, and Monday afternoon, and I literally like could not move. I remember I stood here, and like, so Saturday I was shivering in pain. I was shivering, and of course I didn't understand why, you know. At that point I should have clicked. But then Monday, like, it got really bad where I was shivering, like I started crying because I couldn't even move. Like, I legit could not even move. And it was just horrible. And at this point my incision was a lot more inflamed and red, and it hurt. Like, it literally hurt to wear. Like, if I were to wear underwear or anything that would touch it, it would hurt. So then that night we ended up going to the hospital, or I did, because of course, because of Corona, no one can go with you. So I ended up going by myself, and good old Google had told me that it might have been infected. So I went in with that idea that I had been infected because of how it looked, and it just didn't seem right. So then I went to the emergency room Monday. They looked at me and they're like, yeah, you have an infection, and they gave me amoxicillin. That was Monday, and the plan was to give me antibiotics for 7 days, and then I would see my doctor, my OB, the next day. So the next day, Tuesday, I went to my OB's, so that would have been the 9th. I went to my OB, and this is a whole different story, but I went to my OB, and she pretty much just said, like, it's getting better compared to how it was, because at the hospital they circled like around the infection so they could see if it was like bad or not. And so then Tuesday she said, like, it was oh my gosh, I just got a text message, but anyways, so Tuesday she said, like, it's getting better. And so then I kept on the antibiotics, and like, and the drainage kept getting worse and worse, and so, and the pain as well. So I was like, oh, you know, I probably have to get better. I mean, worse to get better. So that happened Tuesday, and then by Wednesday morning, like, I mean, I am literally talking about how my underwear would be like soaked, like literally soaked, and like discharged from the incision. And so at that point I should have caught on to what was happening, but your girl didn't. Okay, so like I was saying, so it was Wednesday. So by Wednesday it was a lot worse. So I had gone to the emergency room Monday. I went to my OB Tuesday, and then my next appointment wasn't till Friday the 12th. And mind you, at this point, my drainage was like really bad. Like, I'm talking about like, it was like really wet, and it was like pus, and there was blood coming out of it. So I knew something was wrong. Like, I knew, and the pain kept getting worse. So then Friday came along, and I ended up going to my OB, and at this point I couldn't even walk. Like, I legit could not even like function. And I remember the night before, like, I was sitting on the couch, and I had like my nightgown on top, like on me, and by the time that I came up, like, all the discharge had soaked through my nightgown. Like, I'm talking about back and front, and I knew it was discharged because like I could see the color of it. So then obviously something was very wrong. And I recorded, like, I took pictures and I recorded every day of the incision to see like if it was getting better or worse. And like, let me tell you, it was bad. It was bad. So then I would show you guys, but it's very graphic, so I'm not going to. But it was Friday, so then that Friday my doctor had kind of mentioned to me, previously she had mentioned to me that, you know, that if it didn't get better that we would have to do surgery. and that freaked the crap out of me. So then, you know, we tried, and at that point, like by Thursday, I knew that the pills weren't working. Like I knew something was wrong. So Friday we get there, and she just pretty much tells me like, you have to go. Like you can't even like. She's like, you can't even go home and get your stuff. Like you need to go to the emergency room. And I was like, oh damn. And so then it was kind of more like, you know, you're most likely gonna have to have surgery. In my mind, I was like, oh my god, like I literally just gave birth to this baby, like not even like a week ago. Like I just gave birth, and like I would have to like I'm not gonna have surgery for one day, and then they're gonna let me out. So then we ended up leaving the doctor's appointment, going straight to the hospital, and again I had to go in by myself because there was no one allowed, which totally sucked, but you know, I understand. So I got to the hospital by 4 p.m. and I was checking in, and then I literally remember, and it was probably because I looked so bad, like I looked so pale or something, that before I walked into to check in to go up to the OB triage, there was two people, and they kept asking me like, are you okay, are you okay? And I was like, yeah, like, you know, I'm in pain, but I'm okay, like I'm not, you know, suffering. I mean, obviously I was, but so I get to OB triage, and it was like around 4 p.m. and granted I already had been there on Monday, so they kind of already knew what was happening. So then I show up Friday, and then it was probably like 4 p.m. Friday, and no joke, by 6 p.m. I was already in surgery, and I was like, it sucked. So previous to that, from 4 to like 6, we had the general surgeons come in and talk to me about, you know, surgery and how it was infected and how it was gonna happen. You know, it needed to happen. There was no way around it. So then they mentioned that my surgery, it wouldn't cause too much damage, that it would just be 2 small holes on each side of my skin, of my incision, because they were gonna just drain it. That was the plan. So then I was like, okay, you know, and I asked them like, I'm not gonna get discharged soon, and they're like, no, you're probably gonna be here over the weekend, and this had been Friday. And of course I was torn. I was like, no freaking way, like, you know, I didn't want to be there. That was the last place I wanted to be. So then, you know, they kept coming in, and it was so tender, like they couldn't even touch it because it was so painful. Like legit, it hurt more. This hurt more than I think than giving birth. Like when I was pushing and stuff like that, it was bad. So then I ended up having surgery at 6 p.m. again by myself. Like there was no one there. And then I do remember that surgery took an hour. I was in the OR for an hour. And then by the time I came out, you know, I was fine. Like I was okay. And then I got to my room, and they were kind of just telling me like, you know, this is what happened. And the doctors came in. And this is where it kind of scared me, and it kind of scared everyone else, because like, whew, so my doctor said, he's like, if you wouldn't have came in today, like you would not have made it. And I was like, what? So pretty much what ended up happening was that my infection was so bad that it got really, really bad, that they were scared that it was going to turn into flesh eating, and that it was going to spread. And you know, hearing the doctor say like your life could have been, you know, at risk, I like, whew, it was scary. And I remember thinking to myself like, I don't know, like I don't even know how I made it, because people were like, how were you even walking? Like I have no idea. So then he tells me that, and I call my parents and I call my husband, and I'm just like, I'm fine, things are good, I came out of surgery. But the one thing that I will say is that I literally, the second I got out of surgery, I felt so much better, like so much better. Yeah, I was in pain, but it was like a completely different kind of pain. Like it was just like, and that's one thing that my doctor surgeon said. He's like, you're gonna feel a lot better. Like it's an inconvenience to you, but you're gonna feel better. And then it was time for my dressing change, and oh my god, it was a shock, to say the least. Okay, so it was come time. Ugh, can't even talk. It came time for me to have my dressing change. And mind you, when I came out of surgery, I had like a whole faja, like you call it an abdominal binder. So I didn't see, like, I couldn't see what the surgeon had done. He just, didn't even mention the wound or anything. He just pretty much mentioned like, hey, we're done, stuff like that. So then, mind you, in my mind, and according to what the doctor had told me, previous to me going to surgery, was that I was only going to have 2 holes, like small holes on each side of my incision. Boy, let me tell you. And shout out to the nurse who did this, because so she was changing my dressing, and I had asked her, and like I felt her like moving stuff, and I asked her, I'm like, can you take a picture of it because I want to see it, because obviously it wasn't 2 holes. Like I knew it was not 2 holes. And so then she's like, are you sure? And I was like, yeah, like I'm positive, I want to see it. And she takes a picture, and legit, it was like the grossest. It wasn't the grossest thing, it was just like the scariest thing that like I didn't imagine, I didn't picture. So what ended up happening was, from those 2 holes, it went down to being my incision was 21 inches longwise. So across my stomach, 21 inches longwise. From top to bottom, it was 2 inches, 2.5 inches from top to bottom. And then at one point in it, it was deep inside 2.7 inches. So, like, it was like deep. So from 2 holes to this big old thing. And I remember her, like, they call what's called packing, where they have to pack gauze pads into your incision. And that was when I was like, oh damn, this is a lot. So then that's kind of when I knew, like, this is not something that was easy. Like, this was something that legit could have like killed me, because like they took out so much. So I did a debridement. So they took out a big old chunk of my stomach, pretty much, because it took out all the infected stuff. So they didn't want to keep the skin there if it was gonna be infected. So then the dressing changes were the worst, because they gave me this antimicrobial, y'all don't even, it's pretty much like, the lady at the hospital explained it to me, like, it's kind of like pool chlorine, because it's supposed to like clear out the infection. So then that was Friday night, and then I did not get discharged till Tuesday, that following week. And I was so upset, because my baby, I had just started breastfeeding and all that other stuff, and then it just kind of, it was crazy. So I got discharged Tuesday. They did the corona test, the COVID testing on me, and it was negative. And then Tuesday I went to my regular doctor. No, Tuesday I got discharged. And then Wednesday I ended up going to the wound doctor, the wound clinic. And that's where they were going to do the treatment for the wound, because as you can remember, I still had an open wound in my stomach. Like, it was widely open, because the original plan was to have a wound vac. set up, but then it didn't even end up happening, and it was just like, it was just too complicated, and then hospital couldn't get it done, and then I was supposed to get discharged Sunday, but then they were trying to get the wound vac people to do it, but it was on a weekend, so they were like, okay, wait till Monday. Excuse me. So I waited till Monday and nothing, and they're like, okay, give us, tonight to work on it. And so then I ended up staying 2 extra nights, so I should have been home Monday or Tuesday, but I couldn't because they were waiting for the wound vac. So then I got discharged, and then at the wound clinic, they kind of just told me, like, hey, you're gonna have to change your dressing by yourself. And that was like, hold the fuck up, like, what? So I ended up having to, I'm still doing it. I still have the wound, but I ended up having to change it myself 3 times a day, and it was hard. It was really, really hard because you have to pack in the gauze. And remember, there was an indentation like of 2.7 inches, I believe. So I remember my doctor told me, she's like, when you shower, like, you can shower, but just use your hands and like clean inside. And I was like, oh hell no, like, there's no way. So then I remember sitting in the shower, and like I sat there and started cleaning it, and legit, no joke, I could fit like the top of my fingers, like all these fingers from here up, I could fit that into the incision. And it was like the weirdest thing. It was so weird. So then that ended up happening, and so then I ended up having to have that and take care of a newborn, which was, and it's still hard. But yeah, but now it's been almost a month. Yeah, it's been a month. And actually, I think it's a month today. Oh no, it's a month on Sunday that I've had the surgery, and it is just like nuts, because it's like, how do you explain me getting an infection? Like, there's no reason to why I got infected, obviously. I don't think that it was something that I personally did, because I didn't even have a chance to get home. And so, I don't know. I don't know what happened. And they did test it, and like, to see what happened. But my doctor, my OB, just said that it was because I had bad luck. Yeah, I didn't like her answer, but whatever. So yeah, that is my birth and delivery story. So if you guys see me on Snapchat, like when I post in the hospital, that's where I'm at. Like, I literally, and it's so inconvenient because I have to go to 2 appointments every week. I have to go to my OB appointment to check up on my wound, and I have to go to the wound clinic every week as well. And it's annoying and expensive. But yeah, that is my labor and delivery story. It is crazy. It is unexpected. It's just what happens, I didn't plan it this way, but that's how it went. But anyways, you guys, that is my story. I know it's a long video. It's just a lot of detail that I had to talk to you guys about. But if you guys have any questions about dressings, hit your girl up. I mean, I've done it a lot now, so yeah, that's that. I will insert a couple pictures of my baby. Actually, I'll probably do like an introduction video to her, now that I think about it. But yeah, her name is Sophia Olivia Gutierrez, and she's precious. So I'll put pictures of her up after this. But anyways, but thank you guys. I appreciate it so much, and talk to you guys later.